Good morning. I'm Amy Shuklian, Tulare County Supervisor, and Labor Day is just a few days away, I'm sorry. Many of us are looking forward to it, as we always do, but we all know this is not a typical Labor Day this weekend. It's 2020, and we're in a pandemic. And while staying safe is important every Labor Day weekend, this year it's particularly important. Safety. That's why we're here today. It's why our sheriff is here, our local healthcare professionals are here, and we've come together today to make sure that you keep safety at the top of your mind this weekend. Today you'll hear updates on COVID in Tulare County, along with what you can be doing to stay safe when you're out and about this weekend, whether it's at home, on the road, or on the water. You may have questions, so please ask them along the way in the comments section on Facebook Live, and we will do our best to get them in this hour. Any questions that are not answered here on live will be answered within 24 hours in the comment section on Facebook. So with that, let's get going. I'd like to welcome Tim Lutz, who is the Agency Director of the Tulare County Health and Human Services Agency. Tim?
Good morning, and thank you, Tulare County, for listening and taking our recommendations to heart. We continue to see widespread COVID-19 throughout the county, which is either directly or indirectly impacting every group. It's important that we remember no group is immune to COVID-19. To date, we are at 14,442 cases, and today we're currently a little over 800 active cases within the county. Locally, we saw our cases jump significantly starting in the early summer, resulting in one of the highest case rates in the state of California. This heavily taxed our healthcare industry, testing capacity, and our ability to effectively investigate new cases and conduct necessary contact tracing. And crucially, this significantly hinders our ability to return our children to in-person learning and reopen many of our businesses. And currently, finally, in mid-August, we started to see a downward trend in our cases. We are now 2 weeks of sustained improvements in our case rate and testing positivity. Our community is making progress in this battle against COVID-19. Please understand that our case rate and testing positivity still remain very high relative to many parts of the state, and there is still much to do in the coming weeks. We are asking everyone to continue doing their part in following the guidelines by wearing face masks, socially distancing, and avoiding gatherings. And this does bring us to why we are here today specifically, and that is to ask all of your help. As we come up on the last holiday weekend of summer, we want to remind the public to heed the lessons learned. We have seen large spikes of COVID-19 cases following holiday weekends. We saw spikes following the Memorial Day holiday and in rapid proportions following the 4th of July holiday. This virus continues to be fatal, and spikes in cases following the 4th of July sadly resulted in the passing of over 100 Tulare County residents in just 2 short months. The majority of these deaths in the past 2 months were not individuals residing in a skilled nursing facility. For this Labor Day weekend, it is imperative we avoid large crowds and gatherings. Our contact investigations show that around 40% of our recent COVID-19 cases are stemming from exposure at a group setting. If we can limit our gatherings, we can in turn reduce the amount of COVID-19 cases occurring in Tulare County. That'll allow us to lift more of the restrictions for our local businesses and to return our children to in-person learning, which we all want to see. Not only will reducing the spread of cases help us get back to a sense of normalcy, It will also prevent additional losses of life. The choices we make today directly impact our ability to resume that greater amount of normalcy. Please wear a mask, wash your hands, and avoid gatherings. Together as a community, we can reduce the spread of COVID-19. And with that, I'd like to ask the Tulare County Sheriff to come up and also say some words.
Thank you, Tim. Well, good morning. My name is Mike Boudreaux. I'm the sheriff here in Tulare County. I just want to start off by saying we are going to be okay. We are going to get through this. All of us are working together. Our communities, our schools, our churches, everyone is working together for a positive result. We're going to be okay. But it is going to require our continued effort and support from everyone. As you heard from the county health director, the importance of not having large groups of people come together, for example, in parties. We have seen spikes where there has been large parties, and out of those large parties, spikes exist. So what I would say as sheriff, please, let's be mindful of what the future holds. I have children. I want my kids back in school, just like each and every one of you. I want to be able to dine in at our local restaurants and be able to get a haircut at my barbershop. But just like you, we're looking for that positive end result. We are going to get there. Let's stay positive, but let's each and every one of us do the important part. I also want to talk about some enforcement efforts when it comes up to the role of the sheriff. What I have decided to do, and I've made it very clear, I don't want to be the law enforcement component that is giving citations or making arrests for not wearing a mask. Now let me say this, I have seen the majority of our population wearing masks. And I'm thankful for that, so that we don't have to give a citation. But I don't want to be that component. But what I do want to do is make sure that our community and everyone who lives here is well educated on the importance of wearing a mask, the importance of good social distancing. And so what we have done here at the Sheriff's Office is we have gone out into our community and we have done food giveaways, drive-through food giveaways. And we've given out over 20,000 boxes of free food to our community in need. But during that time, we also handed out thousands of free masks. And we have children in our community that just didn't have that resource, but now they're wearing those masks. So what I'm trying to say is, let's work together. If you see someone in need, give them a mask if they have the opportunity to receive, and be a part of a positive result. Now, I'll step away from COVID just for a second. I want everyone to know that here in Tulare County, Labor Day weekend is a big weekend for us. And we have a lot of enforcement effort out on the street for a couple different reasons. One is, this is a time where people typically relax a little bit and have some alcohol. Alcohol while driving in a vehicle, we're going to suggest, not even suggest, we're going to demand, don't do it. Because we do have enforcement effort out there, and if you choose to drink and drive, you will have the opportunity to come into my jail and sit there and think about that bad decision. We want our children safe, we want our families safe. COVID is dangerous, but so is a drunk driver. Please do not be drinking and driving while on the road. That is something we will enforce, and we want to make sure that you hear that from us. Make sure you have a designated driver. Also, our waterways. This is a time where we're coming into the fall season. Everyone sees the opportunity for one more time on the lake, one more time on the river. We understand that, but we want to enforce. Don't drink in a vehicle, don't drink on a boat. Make sure that your children all have safety vests. There's a misunderstanding sometimes how a drowning occurs. Drownings can occur very quickly. And so we would advise you on our waterways to use good boat safety, good safety practices with life preservers, and please don't drink and drive, don't drink and boat. So with that, I'll end. We want you to have a safe Labor Day weekend. We want everyone to stay alive, but we also want everyone to stay healthy. I'll, at this time, introduce the CEO of the Kaweah Delta Hospital, Gary Herbst. Gary.
right, thank you, Sheriff Boudreaux. I appreciate the welcome. Thank you for this opportunity to interact with our local media and get our message of safety and good habits out there to our community as we approach the Labor Day weekend. As the sheriff said, my name is Gary Herbst. I'm the Chief Executive Officer at Kaweah Delta Medical Center here in Visalia. It's hard to imagine that just a few weeks ago, Kaweah Delta was caring for 91 COVID positive inpatients in our medical center. Many of them in our intensive care unit and our intermediate critical care unit, many of them requiring mechanical ventilation to help them breathe. It was the highest COVID population or census that we had cared for during the entire pandemic. And with the community's help, as Tim Lutz made reference to, we've seen a pretty dramatic drop in our COVID-19 census. We're holding pretty steady at around 35 patients, 35 positive COVID patients a day. Although every morning at 6:30 in the morning I get a daily update, and we saw a slight tick up. We have 40 COVID positive patients today that are in the acute medical center, 9 of them in the ICU and 8 of them on a ventilator. And I truly credit the community for helping us achieve that rather dramatic drop, particularly in those patients that are requiring hospitalizations. The number of new cases that we have been witnessing over these last several weeks, not just here in Visalia and at Kaweah Delta, but really across the county, and the positivity rate. I really appreciate the county routinely putting information out there for all of us community members to be able to track and really see the fruits of our efforts, because they really are making a difference. Wearing a mask, social distancing, washing your hands frequently, and avoiding large gatherings, they truly work. And again, the evidence of that is what we've been experiencing over the last several weeks, that I think the reality is kind of setting in a bit. When right after the 4th of July holiday, generally about a week and a half after that, that's when we experienced this incredible resurgence. So there definitely is a correlation between holidays, large gatherings, kind of relaxing our vigilance, and then we see that huge spike in the positivity rate and the increase in hospitalizations. So as this holiday, this Labor Day holiday is approaching, Kaweah Delta kind of finds itself literally almost sitting on the edge of our seat, holding our breath, hoping that we don't experience the resurgence that we saw in July. And it wasn't just 4th of July. Unfortunately, we saw it around Easter and Mother's Day and Memorial Day. There's a consistent pattern of folks just, again, kind of letting down their guard, and then we see the impact of that after the fact. So please, this holiday, really be safe out there. I know everybody's restless, we're frustrated. It is a time to celebrate the wonderful things that are in our lives, but again, think about the safety of others. I want to reiterate what Sheriff Boudreaux said too. It's not just COVID that I ask you to really be careful out there. Sadly, as a level 3 trauma center here in Visalia, we do see the effects of drunken driving and drunken boating, and we see trauma, sad, tragic trauma that comes to the emergency department during these holiday times that really can be avoided. So again, implore you to exercise really safe practices over the holiday weekend. And also, the medical center, and I know this is true of Sierra View Hospital too, we continue to take care of hundreds of non-COVID patients. Again, people that have been in accidents, they're injured, they're sick, suffering heart attacks and strokes and things of that nature. So we're very, very full. At 6:30 a.m. this morning, we only had 27 of our 252 non-COVID beds that were open. So if you need our care, we absolutely will be here for you. If you need a bed, we will make it available. But I'm just, again, asking the community to do everything you can to be safe over this holiday weekend. And lastly, to kind of end on a positive note, I know the thing that's been very frustrating for a lot of folks in our county, is how do we get that positivity rate down? How do we get below 8%? Because I think the county has done an incredible job really following the CDC guidelines. For the most part, we've only been testing symptomatic patients, which is going to cause you to have a much higher positivity rate. I think we're seeing in other counties that they're testing virtually anybody that wants a test. So you're going to test a lot of people that don't have the virus. And so that's that denominator. The more testing you do, the more likely you are to see a decline in that positivity rate. But at the same time, we also need to avoid contracting the virus and putting ourselves in situations where we're more vulnerable to that. But Kaweah Delta has just recently acquired a new antigen-based testing platform called Quidel Sophia 2. It's a very rapid test using fluorescent light and ultraviolet light. Literally allows us to have test results in 15 minutes, so really point-of-care testing. We just received 20 analyzers and 20,000 testing kits, and we have on order another 50,000. So we're working carefully with the county to deploy these analyzers throughout the county, place them in various clinics and other sites so that we can do much more extensive testing and get those rapid results back to people so that we know who we need to quarantine and what exposures have been out there. So again, thank you to our community for everything that you've been doing. We greatly appreciate your support. I want to thank Tim Lutz, our Director of Health and Human Services, Sheriff Boudreaux, and my good friend and colleague, Donna Hefner, the CEO at Sierra View Hospital. They've been incredible partners throughout this pandemic, and we have greatly valued working with them towards this common cause. So thank you, everyone, and now it gives me pleasure to again introduce my colleague and my friend, Donna Hefner, the CEO at Sierra View Medical Center.
Good morning, and thank you, Gary. It's my honor to be here today in a partnership with the county and local law enforcement and our city local government. We are here with you, standing united in regards to this pandemic. So I wanted to touch this morning on a few elements, how in regards to the hospital update. We, as well in the southeast portion of Tulare County, 18 days post the 4th of July when we stood here before you at the press conference encouraging these recommendations of the social distancing, the masking, avoiding crowded spaces. We did see that resurgence, and it continued not only for weeks afterwards. We've seen a decline recently in the last week of our hospitalized positive COVID patients. Today we have 16 hospitalized COVID patients and suspected patients with COVID. So that is obviously a decrease, but we are here asking you for your help. So what do we expect 2 weeks past? We do expect increased testing, and that's why Gary touched on the importance of having the testing capacity. And although we are still testing those with symptoms, we stand united in helping you identify if you have COVID and then getting you the health care that you need for your treatment so you can recover. So we have seen that our practices that we put in place are working. In our organization, we have had 40 employees who have tested positive, who've had to also remain out on quarantine. So keeping our healthcare professionals safe and healthy is really, really important for us so that we can continue to serve you. So we will continue our effort there. I was asked to touch on kind of what to expect in regards to flu vaccine. We're approaching the fall, and it's the time of where we encourage our community to get their flu vaccine. So let's start with what flu is. Flu is a respiratory illness. Really important that over time, this vaccine helps people build an immunity. And so there's a lot of questions out there in regards to who should get vaccinated. Obviously, anyone over 6 months of age should be getting vaccinated. So we're in this period of time. It takes 2 weeks once you receive your flu vaccine to actually get immunity. So we obviously, September, October is a good month to start making sure you take part in getting that vaccine. So a lot of questions come up in regards to if I get the shot, am I going to get sick? The flu vaccine is what we call a killed virus, so it's not an active live virus in the shot form. So there is this period of time, as I mentioned, of the 2 weeks of building that immunity that someone could be exposed to the flu and actually acquire the flu during that period of time. So there's a lot of questions in regards to COVID and flu, although I'm very encouraged based on what I'm reading on the literature that we will see a vaccine for COVID in the early part of 2021. But obviously, we want to encourage you to take part of the flu vaccine and build that immunity. Just to kind of statistically, in regards to CDC, flu claimed the lives of 62,000 lives were lost in 2018 to 19, and COVID is claimed over 150,000 lives. So obviously, getting the flu vaccine does not protect you from COVID, but the social distancing, the masking, the hand washing, covering your coughs and sneezes have a dual benefit of protecting not only others from you. So please continue those practices. So thank you for your time. I just also was asked to touch on the alternative care site at Porterville State Developmental Center. We currently have an alternative care site that is open. It is staffed. We have transferred over 50% of the patients to that site and been very successful. We also currently have 10 patients that are being treated out there. And that site will remain open to the end of September from what I've been notified. And so at that, I'll entertain questions at the end. Thank you.
That's fine. Okay, thank you, Donna. We are now going to be taking questions. As I said earlier, if you'd like to comment on the Facebook comment section, we'll write those down and answer them with the appropriate person. If we're not able to get to all of those questions during this time, we will be answering them in the comment section. So our first question is from Jason Oliveira of Channel 30. And the question is, how big is the concern of large gatherings this weekend that could result in large COVID cases butted up to flu season? Donna or Gary, would you like to answer that? Thanks.
Yeah, thank you for that question. And just to reiterate that we are very concerned about the large gatherings. Literally right after the 4th of July, when I expect we had many large gatherings. In fact, I told a story where I was at Costco picking something up for my wife and I to barbecue. Sadly, it was just the two of us over the 4th of July. We didn't have even a small gathering. But I saw a couple filling their shopping basket with about 50 racks of ribs. And I just knew that had to be the making of a large gathering. And essentially, that's what we saw. We saw this huge spike. Again, not just in our county, it pretty much was statewide, nationwide. So we are very concerned because literally that 2-week period right after the 4th of July, Kaweah Delta was almost overwhelmed. Not only were we taking care of 91 COVID patients, but also just all of those other patients. Literally every single bed was filled almost every day. And we had lots of our employees, unfortunately, that had contracted the virus and were quarantined at home. And fortunately, we've seen a lot of our employees come back to work. I think earlier this week, we reported only 50 of our employees, mostly nurses and LVNs, were actually still at quarantined at home. There was a point, again, back in July, we had well over 100 almost every day, and that certainly is impacting us at a time that we're full. So as Donna referenced, we're very worried about the 1-2 punch. that we'd be battling a COVID virus with no vaccine and the flu. And we never know how severe the flu is going to be. 2 years ago, the 2017-18 year was one of the most severe flu seasons in the last decade. And we saw many, many of our patients that were being hospitalized, many young patients that were hospitalized in the ICU. The number of people that unfortunately died from the flu in Tulare County and across the country was one of the most severe that we'd seen. So we, there are things that we can do. Definitely vaccination. Vaccination is the number one thing that you can do to avoid contracting the flu, but we also find that it's not fail-proof. If you get vaccinated, you can still contract the flu, but generally the symptoms that you experience are much more mild. So Donna and I both greatly encourage you to get the vaccine. But also what we're going to see is if we continue to follow these great behaviors, washing our hands a lot, wearing a mask, social distancing, that also can have a very positive effect on keeping the flu down as well. So short answer, yes, we're very worried. And that's why we're really here today asking for the community's help. Avoid, I know it's very frustrating. We want to get out there. We've been at this thing now for way too many months, and we're growing restless and frustrated. But let us get through this holiday. Let us, practice those good behaviors. And as the sheriff said, we'll get through this. We'll be okay. So thank you.
Thank you, Gary. Our next question is from Jocelyn from KC24. The question is the county doing anything to try to discourage gatherings such as capacity limits at parks? Will the sheriff be giving citations for large gatherings? I'll go ahead and answer this one. The county has not been taking any reservations at our parks throughout the pandemic. We have closed our arbors and playgrounds. So, in talking with the sheriff also, they will be doing their usual patrols, but they will not be citing anybody. As the sheriff has been doing all along, he will be encouraging folks to social distance and also educating them, and I'm sure handing out masks should folks not have that. So we will be doing some discouraging of park limitations. Okay, our next one also from Jocelyn at KC24. We were told the California Medical Assistance Team helping with the Porterville alternate care site had to be deployed to fires. Has the site been able to make up for that staffing shortage? Donna, would you, or Tim? Okay, Tim?
Yes, so the CalMat team has been or was deployed to the Porterville Alternative Care Site. In light of the fires, they were reassigned to other parts to assist frontline operations and support our firefighting personnel. However, what we also have been seeing is a declining census as both the Kaweah Delta and Sierra View CAOs noted, or CEOs, sorry, noted that we have seen a decrease in our hospitalizations, which also means fewer people need to go to an alternative care site. They're set up to provide a relief for our hospitals in the event we see surges in COVID. So the plan right now is mid-September that site would be closing down and not taking any new patients. Right now, they're taking up to 10, as the Sierra View CEO referenced. And then if the need were to arise where we suddenly see another spike, certainly we would be working with the state to bring resources back to staff that facility.
Thank you, Tim. Any more questions? Thank you. This question is, what is the turnaround for testing?
So yeah, that's an excellent question. Turnaround times do vary significantly based on where the sample is sent to. So the way that testing works is you might go to your to a hospital, you might go to one of the various collection sites around the county, and either those tests are then taken to our local public health lab, to Kaweah Delta's lab, where we have much faster turnaround times, typically within a day. Commercial labs for a while, and was well discussed and documented, were seeing significant turnaround times of the 7 to 10 days, which really negates the effectiveness of testing. Recently, we've started to see some improvements on turnaround time. The state is trying to redirect some of the collections to labs that might be smaller capacity overall, but were not being utilized or taxed as heavily as the largest of the commercial labs. So we've gradually seen that improve to around the 4 to 5 days. Still a significant delay that we really want to continue to see improvement on, but it isn't as bad as it was in mid-July when we were seeing that on near 2-week turnaround.
I also want to add to that is that we do have a new testing site, one of the state testing sites, OptumServe, that will be opening today at the Tulare Agri Center. So that makes Dinuba, Porterville, and Tulare that have the OptumServe sites. You can go on the website, and we'll get that for you in just a moment, where you can make an appointment and get tested. And I don't believe you need to have a doctor's referral or anything, correct? Okay. Do you have any tips for a safe social gathering this weekend? Don't gather. Of course, in large groups, we ask that you stay within your household. Should you venture out, of course, we want you to maintain social distancing. We want you to wear a mask and continue with the hand washing and sanitizing protocols. But again, bottom line is, if you can not gather, that's what we're encouraging folks to do, is not to gather this weekend. I talk faster than they can write. Okay, this is a question from Facebook. As of today, are we experiencing an uptick or slowdown in the spread of COVID? Tim?
So as of today, we are seeing a decrease in our COVID case rate, which is reflective of the amount of spread across the community. But again, I want to emphasize that our case rate still remains amongst the highest in the state, and we still have a long way to go before we're in that comfortable territory where we feel that we can effectively control any new outbreaks or spread quickly to avoid more widespread cases.
Okay, we have another question. How big of a portion of the cases in the county have been within the agriculture community? How much of concern is this, and what is the county doing to support essential workers? Tim, I'll have you speak of that. We've been talking about that quite a bit within the county.
Yes, that is a absolutely crucial question. We provided a presentation to the Tulare County Board of Supervisors yesterday to outline some of the coordinated programs that we're doing to try and provide support and relief to those most impacted by COVID. And we do continue to see indications that it's disproportionately impacting our farm working community, our food processing workers, and other types of environments where it's not possible to telework, and people have to come in oftentimes in close proximity to one another. We are launching an initiative called Healthy Harvest that is coordinated with the California Department of Agriculture and the Central Valley Community Foundation. And within that program, we are going to be providing targeted wraparound services to all of those within the food production, food processing industries. That would include providing hotels for those that can't socially distance, to provide food and supplies not only for the person who is having to quarantine, but also for that person's family, so that we can ensure food continues to get on the table, that rent and utilities would be offset or taken care of through the program. Again, with the goal of trying to reduce some of the barriers to those who can't adequately socially distance and isolate at home. So we take the efforts very seriously. We have a community care coalition that has over 40 organizations at the table, serving a wide variety of our population in the county. The goal there is to avoid any duplication of efforts and to make sure that we're coordinating. That group meets on a weekly basis and continues to address any new funding opportunities and build programs as opportunities arise.
All right, thank you, Tim. I don't believe we have any more questions. Should anybody come up with any questions at a later time, you can certainly post them. This will be posted on the Kaweah Delta website, also Tulare County Health and Human Services Facebook page, I apologize, and I believe the Tulare County Sheriff's Facebook page also. Bottom line, celebrate Labor Day, but adhere to public health guidelines. Limit social gatherings, do your best to avoid crowds, and celebrate at home as much as possible. Be safe on the roads and in the water, as the sheriff mentioned. It's going to take each and every one of us working together to stop the spread of COVID-19. Be mindful that everything you do this weekend, especially during the pandemic, is going to have an effect on everyone for weeks to come. So again, I'd like to thank our speakers, Tim Lutz, Tulare County Health and Human Services, Tulare County Sheriff Mike Boudreaux, Kaweah Delta CEO Gary Herbst, and Sierra View Hospital CEO Donna Hefner. Thank you again for being here, and thank you for joining us.